name is Zahra Choudry, and I'm an environmental health ambassador with the Huntington Breast Cancer Action Coalition. Did you know that 13.7% of Americans in 2021 live underneath the poverty line? Of these millions of people, 1/3 of them live in deep poverty. Poverty is a complex issue that lowers the quality of living for those suffering with it, but it is also a determinant of health and health outcome. It restricts the ability to create healthy habits or avoid unhealthy behaviors. I grew up with two working parents who were pretty busy pretty much all the time. They had just moved across the world into a whole new country with two very young kids, me and my brother, and they had to figure out how to make a living. Their busy schedules persisted for years and well throughout my childhood. Long working days mixed with the responsibilities of two young kids caused a lot of takeout days within a week. We used to love the huge KFC buckets that were only $15 and would last days, or the Pizza Hut breadsticks that I would end up losing my two front teeth while eating. On my mother's days off, we would enjoy her fresh Pakistani cooking, but we used to eat it with the huge buttery naans that were only $1 each. I remember my mom sending me to a babysitter named Maggie with a food called Maggie, which was this type of ramen me and my brother were obsessed with. It was very ironic. I loved Pringles as my snacks and those sugary drinks with the twisty caps. Born out of a need for convenience, it's safe to say my diet was not healthy at all at a very young age, and my body was being plagued by high sodium, processed, and most of the time packaged goods. As these eating patterns persisted, however, the effects began to show. I developed these dark marks on my neck that were a mystery to my parents. They literally thought I just wasn't showering enough or wasn't good enough at showering. My mom would scrub my neck with lemons or chickpea flour, all these other weird remedies to try and cure these marks. But it wasn't until my yearly physical where my doctor told me that no matter how much scrubbing or showering happened, the marks wouldn't go away. Well, at least it wasn't my fault. Well, that's because these were marks based on insulin resistance because my pancreas wasn't working as well as it should. I was so young and my mother was so shocked. My doctor made it clear to my mom that a lack of exercise and unhealthy diet were to blame for this condition, and that it had to be combated immediately or I would develop diabetes or a plethora of other serious health issues like heart disease at such a young age. She also mentioned that it was becoming way more common within children my age. The difference between me and other people facing the same health struggles I did was that we had the privilege to go to nutritionists and took slow but impactful health choices that allowed me to recover. Others, due to money or lack thereof, may not have similar abilities. For example, imagine yourself driving around town. You're feeling hungry and you need to go shopping for necessities, but you need to adhere to a strict budget, maybe just $20. Because of the budget, a quick, reliable, and filling option would be fast food. Go through a McDonald's drive-thru and pick up a Happy Meal for under $5. As for grocery and personal care products, there is no room to be picky or selective. The most accessible, cheapest, and longest-lasting option would be the go-to, especially to stretch the $20 to sustain long enough. But the question arises, is the most accessible, cheapest, and longest-lasting option even healthy at all? So if the healthier options are inaccessible, inconvenient, and unaffordable, maintaining good health becomes an actual real challenge. This scenario is actually perfectly understandable for many of us, and some of us feel or have felt it more than others. In fact, nearly 39.5 million people, or 12.8% of the U.S. population, live in low access as well as low income areas, according to the USDA's Food Access Research Report. It was even found that lower priced foods are more likely to be fattening. Therefore, lower income clearly contributes to worsened health. It restricts the ability to create healthy habits or avoid unhealthy behaviors, as I previously mentioned. Phthalates and BPA seep into the foods we eat and exist in fast food as well. Consuming fast food is already a bad choice that has negative consequences on health and propels obesity, but such chemicals exacerbate these negative effects. What are these chemicals that I'm talking about, and why should you care? Well, a phthalate, or bisphenol A, or also known as BPA, are chemicals known as endocrine disruptors, meaning that they imitate the hormones and proceed to interfere with the endocrine system, and this leads to the development of health complications. There are many serious adverse health effects caused by these disruptors, but obesity is a major focus, especially because it disproportionately affects those with more economic insecurity. BPA and phthalates exist in more packaged and processed foods, like fast food and canned or frozen meals. Fast food and canned or frozen meals are far cheaper than buying freshly made meals and way less time consuming than cooking a healthy homemade meal. Therefore, those with less financial freedom and less time to them turn to them. Although already unhealthy to begin with, endocrine disruptors enter the body and begin to mimic the body's hormones and disrupt important bodily functions, leading to a worsened health and higher risk of obesity. I once picked up a can of chicken soup at the grocery store and decided to read the ingredient list. In the soup, there were far more chemicals and preservatives than actual real food ingredients that I could decipher, as opposed to my mom's homemade soup where all the ingredients are completely natural and I can see what she's putting into them. Like I mentioned before, my mom used to give me and my brother Maggie, the ramen. Recently, I was feeling nostalgic and decided to buy some and make some myself, kind of as a reminder of my childhood. Before doing so, I read the nutrition label on it with a more educated view on what was actually in it. The food that I was eating in my early developmental years was an extremely high sodium, high calorie food with so many chemicals in it that I could barely find any ingredients that I actually recognized. Though we gravitate towards the convenient, cheap, and accessible items and not the fresh, organic produce, the differences are significant. The product is same in name, but the non-organic, highly processed foods expose us to a variety of chemicals. Inorganic produce can have chemicals sprayed onto them, like fungicides and pesticides, meant to reduce pests, but we wind up ingesting them. Like phthalates and BPA, the fungicides and pesticides mimic hormones in a way that disrupts the metabolic processes of the body and also create irregularities in the endocrine. If such systems are being invaded by disrupting chemicals, then weight homeostasis or maintaining healthy weight levels becomes more difficult and the risk for obesity becomes higher. But, as previously discussed, income inequality has also led to poor diet choices, also influencing higher obesity rates. If the organic fresh produce can curb these issues, then it's an easy fix, just switch. The reason is, once again, though, that lack of access due to financial burden prevents us from switching. Organic produce is considerably more expensive than non-organic options, and switching over adds on to grocery bills significantly. Not a good option for low-income individuals. Even if you know all this, it's not always easy to get it. Fast food restaurants actually have a higher density in low-income areas, and the availability and affordability of these unhealthy foods leads to higher obesity rates because it's easier to go to them than the farmers' markets. It's easy to see how lack of sufficient monetary resources could lead in poor food choices, more overall chemical exposures, and therefore higher rates of obesity and other health issues. What can we do about this pervasive issue? Well, some suggest that we should prevent junk food or food with non-endocrine disruptors from being sold, like through junk food tax, for example. However, the issue was never about food choice, but rather the larger issue of economic and financial instability. A tax would only increase the food prices and therefore reduce access, therefore it's inefficient. Programs should not only support those with low incomes, but also increase access to fresh organic food. One of these programs is known as the Fruit and Vegetable Prescription Program, which is a proposed program where healthcare providers can write to the community and to low-income patients for prescriptions for fresh fruit and vegetables. They receive these vouchers to spend at local markets and farm stands and other retail options that serve fresh organic food. Through this option, the price gap between organic and non-organic is closed, and fresher, cleaner food is available for less than the cheap and unhealthy processed and packaged kind. Another way to increase access to healthier, cleaner food options without endocrine-disrupting chemicals is through government subsidies. Government subsidies are basically where the government will pay part of the production cost so that the price of the food can remain low. The reason fast food is so cheap is because the government already subsidizes wheat, soy, and corn, which are essential to fast food production and important ingredients. If produce like organic fruits and vegetables are subsidized, the price for it will decrease and therefore it will become more accessible. What about the individual consumer like you or me? If price is a limiting factor, conscious decisions are always the best way to go. Efforts can be as simple as choosing cleaner produce options, like the Clean 15 that the Environmental Working Group publishes. These are the top 15 produce items that don't have a high pesticide load relative to other fruits and vegetables. We can also avoid the dirty dozen, which are dozens of produce options that have high pesticide load, especially if they are sold as non-organic. Major efforts like growing your own fruits and vegetables are also amazing. In my house, we grow mint, tomatoes, and figs, and it's definitely not as hard as it sounds coming from someone who can't plant anything. It's always a good idea to support legislation that bans the use of endocrine disruptors too. Call your local senator and see what they're doing about it. HBCAC's Prevention is the Cure campaign emphasizes these changes to promote wellness and prevent all types of diseases. Small changes can make a huge difference, as does being aware of the environment and how it affects our health. However, we do need to be cognizant of the ramifications of inequity and inaccessibility and turn our reflections outward to see how we can help each other.